All right, we are going to be working on trunk flexion. The test for trunk flexion is going to be testing the rectus abdominis, external and internal obliques. The position of the patient is going to be supine here with the fingertips lightly touching the back of the head. So go ahead and put your position, just like that. You want the legs straight out, and you as a therapist want to be on the side of the patient, and you're going to be looking for the scapulae to see if they are going to clear the table. And your instructions to your patient is going to be keep your chin pointed toward the ceiling and try to lift your head, shoulders, and back off the table. Go ahead and try that for me. Yep. So she's not quite getting there. If it would be a grade 5, she would be able to complete the contraction straight up like so, okay, making sure that scapula is clearing off the table. Okay, now you're going to move to a grade 4. Your arm's going to be across your chest. And again, keep that chin coming straight up. And you want them to try to lift up so. So that's what I want you to do. Go ahead and try that for me now. Good. And now here I can kind of see those scapulae are coming off the table, so I'm going to assign that an actual true grade 4. A grade 3 is your arms are going to be straight out in front of you, and you're going to be trying to lift up all of the same motion just as a grade 5. Go ahead and try that for me again. Very good. That was a very good grade 3. So you got to use some clinical judgment there. Now, go ahead and put your arms back here. If the patient had extreme hip weakness, you need to stabilize here at the pelvis. The textbook kind of shows holding it like that, which would be good for you to do there. Now we're going to progress to a grade 2. The position of the patient is going to be supine with the knees bent and the arms are going to be at the sides. And the position of the therapist is going to be standing at the side of the table with the hand palpating over the linea alba and the rectus abdominis. And you're going to ask the patient on sequence 1 to lift the head from the table. And if the scapulae do not clear the table, it is a grade 2. So again, I'm going to palpate here. So go ahead and try to lift up. The scapulae do not clear. It's a grade 2. She definitely cleared there. And now what we'll try here next. What we'll try next too is the sequence 2. Like I said, if the scapulae do not clear, but she did clear. But if the scapulae do not clear, they don't raise off the table. It's going to be a grade 2. But if you don't get that, so what you'll do next is you're going to palpate and you'll cradle them. And in this assisted motion here, if you see rib depression, it is a grade 2. But if you don't see a rib depression, you move on to sequence 3. Sequence 3 starts again. You're going to bring them up, cradle, palpate, and ask them to cough. So go ahead and cough. Okay, if they are able to cough, it is automatic grade 2. Head now, please. If it is a no cough if no cough can be ascertained or obtained, then it's a grade 1 if you have a palpable contraction. Grade 0 is if they have neither one of the case.